I really like this article because the kind of, I guess, sort of skipping to the end, the authors assert through their research that um, that while getting uh, behavioral health care to people who have behavioral health needs and what they call serious behavioral health needs or serious mental illness um, is good, but not at all enough to actually reduce risk of criminal justice involvement. And and so they really kind of take and these are my words, not the authors, kind of a social determinants approach to um, criminal justice interventions. So, in other words, the idea is, yes, getting better access to behavioral health care, particularly for people who have uh, behavioral health conditions, is good and can help reduce criminal justice involvement, but on a very small scale. To truly reduce criminal justice involvement, we really have to address these broader psychosocial and social determinants. So that's kind of the theme of this article. And um, the other thing that's really good about this article is it kind of takes us to a little bit of a history of behavioral health access policy and improving behavioral health services to people in the criminal justice system or encountering the criminal justice system in different aspect in different parts of the system. Just a kind of a brief look at the history of policy around that, and then get into their assertion and their assertion why they believe or why they assert that that's just nowhere near enough to truly make an impact on the number of people involved in the criminal justice system.